Many a times a short note is asked in the exam on this topic of classification of antibacterial drugs. So today we will see if such question is asked in the exam, then how to face this question. So friends, before going into the classification of antibacterial drugs, we must know what are antimicrobial agents or what do you mean by antimicrobial drugs. So friends, if we divide the word antimicrobial, then we get two words, that is first is anti and the second is micro. So what is the meaning of micro? Micro means such organisms that we cannot see by our naked eye, and for that we require a microscope. Such type of organisms are called as microbes. And anti means against. So the drugs that act against the microbes are called as antimicrobial drugs. So friends, as we all know that there are 5 type of microbial agents that cause infection in our body, and they are, first is virus, then bacteria, then protozoa, then fungus, and the last are helminths. And the drugs that act against these microorganisms are called as antimicrobial agents. According to the name of each microbe, the drugs are then named respectively, like drugs acting against the virus are called as antiviral agents, drugs acting against the bacteria are called as antibacterial drugs, and so on. So friends, these are some examples of the various type of antimicrobial agents. Most of the time the question asked in the exam is on the classification of antibacterial drugs only, but rarely you may get a question on the classification of antimicrobial agent, and if you come across such type of question, then this is the classification that you have to write. Now we move to our main topic, and that is the classification of antibacterial drugs. So friends, today we are going to see the 4 methods of classification of antibacterial drugs, and the method or the type of classification that you have to write in the exam, that we are going to see in the last. So the first method of classification of antibacterial drugs is on the basis of chemical structure. So what is the chemical structure of a drug? On that basis the antibacterial drugs are classified in these groups. So it's very difficult to remember all these chemical names, and you are not supposed to write this type of classification in the exam. But when we study the antibacterial drugs from our books in our syllabus, then we study on the basis of this chemical structure only. Now the next 2 classifications that we are going to see, they are on the basis of the clinical use of the antibacterial drugs. So the first of this is on the basis of spectrum. So what do you mean by spectrum? The spectrum means range. We divide the bacteria in the clinical setting into 2 groups, that is gram positive and gram negative. So the drugs on this basis are divided into categories, that is broad spectrum antibiotics and narrow spectrum antibiotics. So the drugs that act against the maximum number of bacteria, that is they are acting against the gram positive also and they are acting against the gram negative bacteria also, such type of drugs are called as broad spectrum antibiotics, and the example of this is piperacillin tazobactam. And the drugs that act against a specific group of bacteria, for example certain drugs act against gram positive only and certain drugs they act against the gram negative only, such type of drugs are called as narrow spectrum antibiotics. So the example is teicoplanin and aminoglycoside. So teicoplanin is an antibiotic that acts against gram positive bacteria only, and aminoglycosides are the drugs that act against gram negative bacteria only. And the next method of classification is on the basis of type of action. When the bacteria invades our body, then they start to multiply. One bacteria gets converted into 2, 2 converted into 4, 4 converted into 8, and so on. So the drugs that decrease the rate of this multiplication or stop this multiplication are called as bacteriostatic. So the bacteriostatic drugs, so the example of bacteriostatic drugs are like erythromycin, clindamycin, etc. But sometimes the infection is very severe, the patient is in the septic shock, and in those cases the bacteriostatic drugs will not work, and in those cases we have to use bactericidal drugs. Bactericidal drugs means they completely destroy the bacteria cell and means they cause the death of the bacteria cells. So such type of drugs are to be used when the infection is very severe. So some example of this is penicillin and quinolone type of drugs. Now we are going to see the most important classification of antibacterial drugs that you are supposed to write in your exam, and it is on the basis of mechanism of action of the drugs. So friends, as you can see here, this is the structure of an bacterial cell. You can see the outermost covering is the cell wall. Then the covering inside that is a cell membrane. Then there is two blocks written as 30S and 50S. They are the ribosomes where the protein synthesis takes place. And below that you can see some thread-like structures. They are nothing but the nucleic acids, that is the RNA and the DNA. And in the box you can see that there is written as folate, and this represents the intermediate metabolism that is going on in the bacterial cell. So now we will see how the bacterial drugs are classified on the basis of mechanism of action. So the first type of drugs are called as cell wall inhibitors. They inhibit the formation of cell wall in a bacterial cell. Such type of drugs are called as cell wall inhibitors, and these are the examples. And the most important drugs of this group are the beta-lactam antibiotics. Then the second group of antibacterial drugs are those acting on the cell membranes. They cause leakage in the cell membrane, and in the way they cause small holes in the cell membrane, and after that all the structure that is inside the bacterial cell that leaks out and the bacterial cell gets destroyed. Then the third group of antibacterial drugs are called as protein synthesis inhibitors. What these drugs do, they inhibit the process of protein synthesis in the cell. So protein synthesis is very necessary for the function of the cell, and if the protein synthesis gets inhibited, then it causes destruction of the bacterial cell. So these are some examples. Then the fourth group is nucleic acid inhibitors. These drugs, they inhibit the function of the nucleic acids, that is the function of the RNA and the DNA, and in this way they cause the destruction of the bacteria. These are certain examples of this type of drugs. And the last group is called as intermediate metabolism inhibitors. What is the other metabolism that is going on in the bacterial cell that is inhibited by these type of drugs? So friends, if you come across this type of question in your exam, that is to classify the antibacterial drugs or to classify the antibiotic, then this is the classification that you have to write in the exam. So friends, if you like today's video, then do forward to your friends, and also don't forget to subscribe this channel, and especially recommend this channel to the nursing students who are doing their undergraduate study, because this channel is going to immensely help them in their exam. So friends, we will meet in the next video with a new topic. Till then, thank you.